what we're doing here shows results. The hospitalization rate is down, the number of deaths is down, and the number of new cases is down. For me, I've been focusing on this number of new cases. That's where our health professionals are focused. Why? Because with everything we've done, closed schools, closed businesses, everybody shelter at home, all the precautions about wear a mask, wear gloves, etc., you still have 600 new cases that walked in the door yesterday. Week before that, we still saw 1,000 new cases every day. Where are those new cases still coming from? Because we've done everything we can to close down. How are you still generating 600 new cases every day? Where are they coming from? Again, let's look at the facts, let's look at the data, let's understand and see what we can do. So what we've done over the past few days is we asked hospitals, look at just those new cases who are coming in, right? Yesterday, 600 new cases. Where are those people coming from, and what can we learn from those people to further target and refine our strategy? When you look at where they're coming from, they are primarily coming from downstate New York, which is not surprising. Basically equally distributed. Long Island is 18%. So that's a number that jumps out at you. Rockland, Westchester, which is where we did have a problem, that's down to 11%. When you look at the racial breakdown of who's getting hospitalized, you see it's disproportionately minorities, disproportionately African American and Latino, again in downstate New York. Higher percentage male, 52-48. We don't know exactly why. But the virus doesn't discriminate generally. And a very high percentage comorbidities, which is what we've been talking about and which we understand, which is not a surprise. This is a surprise. Overwhelmingly, the people were at home, where there's been a lot of speculation about this. A lot of people, again, had opinions. A lot of people have been arguing where they come from and where we should be focusing. But if you notice, 18% of the people came from nursing homes. Less than 1% came from jail or prison. 2% came from the homeless population. 2% from other congregate facilities. But 66% of the people were at home, which is shocking to us. Disproportionately older. But by the way, older starts at 51 years old. I'm a little sensitive on this point. But if older starts at 51 years old, then that's a large number of us old folk in this state, in this country. So that whole vulnerable population being old, well, old is now 51 and up. So think about that. 60 to 70, 20%, 70 to 80, 19%. But 51 years old is old. Okay. Then I am very old. Transportation method, we thought maybe they were taking public transportation, and we've taken special precautions on public transportation, but actually no, because these people were literally at home. 2% took car services, 9% were driving their own vehicle. Only 4% were taking public transportation, 2% were walking. 84% were at home, literally. Were they working? No. They were retired or they were unemployed. Only 17% working. So that says they're not working, they're not traveling, they're predominantly downstate, predominantly minority, predominantly older, predominantly non-essential employees, and that's important. We were thinking that maybe we were going to find a higher percentage of essential employees who were getting sick because they were going to work, that these may be nurses, doctors, transit workers. That's not the case. And they were predominantly at home. So now that's only 3 days. That's just about 100 hospitals, 1,000 people. But it reinforces what we've been saying, which is much of this comes down to what you do to protect yourself. Everything is closed down. Government has done everything it could. Society has done everything it could. Now it's up to you. Are you wearing the mask? Are you doing the hand sanitizer? If you have younger people who are visiting you and may be out there and may be less diligent with the social distancing, are you staying away from older people, older starting at 51, by the way? But it comes down to personal behavior. This is not a group that we can target with this information. It's really about personal behavior.